All right, so part two of the independent lecture, just continuing on from this slide. So once again, the ECG represents the electrical changes or activity happening within the heart during a cardiac cycle. So the P wave is representing the activity of the SA node having just fired or sent an action potential. It spreads throughout the atria, and then the atria contract, as you can see in the shaded region back here and behind the P wave. The QRS wave represents the electrical activity spreading throughout the ventricles, and then the ventricles contract, and you see that in the shaded lighter blue region. The T wave represents the ventricles repolarizing, which is just the ventricles returning to the electrical state that preceded the contraction. So that information is written here in this slide for you. And again, just sort of emphasizing that the muscle will not contract without some sort of electrical stimulation. So you can think about, if you're familiar with an ECG and seeing them in different types of health shows on television, an individual whose ECG is basically a flat line would represent that there's absolutely no electrical activity happening in the heart, which then would reflect that there's no muscular contraction occurring either and the heart is not beating. In order to stimulate that heart, what's often done is defibrillation, which basically gives an electrical impulse to the heart to try to kickstart it, to get it to start contracting once again. So the ECG is really helpful to learn about the electrical activity within the heart, and if there's any abnormalities in the ECG, that would indicate to us that there's something happening within the intrinsic system of the heart, so within the conduction system of the heart, such as the SA node or the AV node. There's some sort of disruption in the electrical activity of the heart, which could represent myocardial abnormalities. So ECGs can be helpful in detecting myocardial abnormalities. So basically the heart muscle, the intrinsic system of the heart, is not working properly. All right, having a look at your case study for week 3. Your elderly neighbor, Mr. Diastole, was telling you about his recent visit to the doctor, and he went for a checkup. During his story, he mentioned that an ECG revealed that he had a defective mitral valve and that he had a heart murmur. Mr. Diastole apparently misunderstood some of what the doctor had explained to him about the diagnostic capabilities of an ECG. What did he misunderstand? So your case study will be a fill-in-the-blank activity, and the terms will be provided. So when I see you in lab on Wednesday, we'll sort of go over this lecture. I'll make sure that things are clear and make clarifications if necessary, and then you'll start in with this case study. So please make sure you review this and contact me if you have questions about it. Just a few slides still to discuss this. First of all, what is a heart murmur? That's something you should know the definition of and what it's caused by. And also, how would one detect or diagnose a heart murmur? What are some ways of going about diagnosing a heart murmur? Next, because the case study deals with ECG, you want to think about what does an ECG indicate? What is its diagnostic capabilities? Can it indicate that there is a heart murmur or some sort of abnormal heart sound? And answer to that, so being why, and what could an ECG detect? Okay, so looking at these questions again, heart murmur, remember from previous slides, is an abnormal heart sound that occurs during a cardiac cycle, during a heartbeat. And it's caused by a heart valve that's not, usually it could be that it's not closing properly, so you hear an additional sound other than the lub-dub sound. What is the instrument that is used to listen to sounds of the heart? What do we use to detect heart murmurs? Yeah, it's a stethoscope. So stethoscope's used for listening, and a heart murmur is a sound. So you would use a stethoscope to detect a heart murmur. So Mr. Diastole told you that it was the ECG that detected the heart murmur. So you know in fact that that's not correct. That's what he misunderstood. An ECG will not indicate a heart murmur or any kind of abnormal heart sound, because what an ECG is able to detect is whether or not there's any damage to the heart muscle itself. So it's different from the valves. And an ECG allows us to see the electrical activity within the heart muscle, and so if there's any abnormality there, it could indicate damage or myocardial abnormalities. And what we would see then is that the P, QRS, and T waves might be altered. There's some that might be more occurring more often. There could be larger gaps between them. Whatever it may be, that just the P and QRS and T waves are not appearing as they should be. All right, so we discussed intrinsic control of the heartbeat, which is within the heart itself. It has a pacemaker and it has the capability to control its own rhythm because it's autorhythmic, and the conduction system consists of specialized cells that can generate action potentials. And so we said earlier that basically at a normal rhythm of the heart, the pace is about 70 beats per minute. Now, extrinsic control of the heartbeat basically means outside of the heart itself, what types of ways can we control the rhythm of the heartbeat. So within the brain, we have the cardiac control center. So through nerves, the nervous system, we can affect the rate of the heartbeat, as well as through hormones, which will travel through the bloodstream to affect the heart tissue. So the cardiac control center is located in the brain, specifically in the medulla oblongata, and that can alter the beat. So even though the normal regular rhythm is set at 70, we can alter it to be faster or slower depending on the circumstances of the body and what's needed. So the parasympathetic would really act to help decrease the heart rate, whereas the sympathetic nervous system would help to increase the heart rate during times of activity. There's also hormones, so hormones such as epinephrine and norepinephrine. They're produced and released by the adrenal medulla, and they will travel throughout the bloodstream to stimulate the heart. So you can find more information on this on page 224 as you read through in your textbook. Pulse. So we know that arteries have the ability to expand and recoil because they have a lot of elastic tissue within their walls. And we know that arteries always carry blood away from the heart because the heart is generating force when it contracts. That force of blood then is basically being transferred onto the wall of the arteries, and so causes that expansion of the arterial wall and then the recoil, and that can be felt at certain points along the body. So the carotid pulse is felt along on the sort of the side of the neck. The radial pulse is felt along the radial bone, the radius, at the wrist. And what you can do is basically measure the pulse rate, and it'll give you an idea of beats per minute for the heart during each cardiac cycle. Blood pressure, so you'll have an opportunity to practice and measure blood pressure in your lab. Again, blood pressure can be measured at an artery because the pressure of the blood, it is the pressure of the blood against the wall of the blood vessel of the artery. The highest pressure would be related to when the heart muscle is contracting, so that's going to be during systole, so it's known as systolic pressure. And generally speaking, on average, we'd say it can vary between about 110 to 120 millimeters of mercury for measuring pressure there. The lowest pressure is known as the diastolic pressure, so that's when the heart is relaxing and the ventricles are relaxed, so they're not generating pressure. And that generally, again, will vary between about 70 to 80 millimeters of mercury. So when we write blood pressure, we write systolic as the number on the top of the reading and diastolic as the bottom number of the reading. So we can say something like 110/70. The measurement device that's used for blood pressure is a sphygmomanometer, and so you'll get a chance to practice using those in the lab, as I mentioned before, and talk more about how they work in order to measure blood pressure. So we're not going to be doing any iClicker questions for marks for this lecture, but it kind of gives you a good sort of recap, summary, and practice. So let's go through a few of them here. Which of the following statements is correct for a normal heartbeat? At certain points in the cycle, the atria or the ventricles, or neither, may be contracted. Both right chambers of the heart contract simultaneously in one large surge. All of the heart chambers contract simultaneously in one large surge, or none of the above. Answer is A. So we can have the atria contracting simultaneously, we can have the ventricles contracting simultaneously, or, as you know in diastole, there's a point when all four chambers will be relaxed or they'll be in diastole. Heart sounds result from closing of the heart valves, contraction of the ventricles, opening and closing of the heart valves, or flow of blood as it enters the heart. The answer is A. The heart sounds are caused when the heart valves close. They actually don't make any sound when they open. So it's the closing of the valves that causes the heart sounds. And we have lub when the AV valves close, and we have dub when the semilunar valves close. The function of an ECG is to detect atherosclerosis, clear blockages in arteries, diagnose hypertension, which is high blood pressure, or detect myocardial abnormalities. The answer is, and this is relating to your case study, D, detect myocardial abnormalities. So it cannot detect a heart murmur. Okay, so that actually ends this lecture. Just a reminder, please communicate with me. Please send me emails if you have any questions about the lecture in order to prepare yourself for the case study and for the lab. Please go ahead and look at the animations that are posted on D2L under this lecture, and just prepare for the lab, and I will see you on Wednesday.